It was a longitudinal study from 1932 to 1972 in which all of the data were reported in medical journals as well as to Congress about a study that was being conducted in which a group of low-income, rural, Macon County, Alabama males were told that they were participating in a treatment for bad blood. Essentially, the study was one in which, after having been diagnosed with syphilis, you were told that you were being treated, but you were not. So that they watched to see what would be the results of untreated syphilis on anyone. And the consequences were the same as they would be with anyone. The belief was that this syphilis would in some way be different in blacks than in whites. Many blacks know about that study. Elders know about their study. Their adult children know about that study. And so it makes for a kind of distrust often for some African Americans when they confront the healthcare system.
I would try to be clear with what my purpose is. I'm here to da-da-da-da. You know, this is what I'm going to provide for you. You know, I always ask you, is that all right with you? Do you have any questions? Do you have anything to add? And then I would be consistent. And that's where the trust comes from. Because once you promise something, you have to follow through with it. So be consistent with, okay, I'm going to be here on this day and show up for your appointment. Or I'm going to transport you to this appointment. Make sure that you pick them up on time.
Certain diseases can be more common to specific ethnic groups. For example, Vietnamese women have 3 times more cervical cancer risk than the population as a whole. Education and prevention regarding culture-specific disease risks are important in providing quality care to all people. Reading is a good way to gain knowledge about a culture, but experience is the best way to learn. Attending cultural events such as a powwow, Chinese New Year celebration, or a Mexican festival gives you an opportunity to discover that culture's style of communication and nonverbal forms of expression. Learning a few words of a person's language helps to show respect and build trust. Even if you cannot pronounce the words correctly, just the fact that you've tried will be appreciated. Everyone has the right to make personal choices about health care, and culture often guides those choices. Every human being wants to maintain quality of life, but what defines quality of life may differ from culture to culture. Although we may not always agree with healthcare choices others make, it is important that we honor those choices. Most of us are familiar with the Golden Rule that tells us we should treat people the way we want to be treated. But in the field of cultural competence, the saying has been adapted. According to this new Platinum Rule, we should treat people the way they want to be treated. Remember that the healthcare provider and the patient bring strengths, skills, and values into any situation. A culturally competent approach acknowledges and includes the patient's strengths and values. Cultural competence includes a readiness to respond to the unique qualities of each person in each situation. The most effective approach bridges cultural differences, allowing people to benefit from modern medicine and their own cultural practices and beliefs. When a healthcare provider works in an atmosphere of respect, cooperation, and cultural sensitivity, the quality of healthcare improves, and we reach the essence of our connection with one another. When this happens, the magic of healing begins.